Good morning. My name is Lameka. I'm one of the PGY3s here at UAB, and I'm going to be taking you on a tour in the day in the life with me. So I am on the VA rotation, which is the Birmingham Veteran Affairs Medical Center rotation. The VA is a great opportunity to get a lot of autonomy and a lot of general orthopedic cases. Our attendings take call there. It's low acuity trauma, or ED, so we get a lot of low acuity trauma, general fractures and stuff like that. To do a lot of ankle fractures, long bone fractures, total joint replacements for like femoral neck fractures, and then we do a lot of other general orthopedic cases, including total joints, knee and shoulder scopes, and stuff like that. So I am walking over to the VA through our main hospital. But this is our main hospital. We'll park in our parking deck and walk over to the VA. So I'm going to show you just a few things. There is a Starbucks right there. It's actually closed right now, but don't worry, it's only for 2 weeks for renovations, I asked. Down that way is our cafeteria. It actually has really good food, especially the breakfast. So that is a plus. And then you get a resident discount, which is like 60% off. So my breakfast will be like $1 sometimes, and I'll have like a bacon, egg, and cheese biscuit or something like that. But so that's always really nice. Our ED is down there. Also spend a lot of time there. So all of our hospitals, our Children's Hospital, Main Hospital, our UAB Highlands, are all within like a few blocks, maybe 5-minute driving distance from here to Highlands. But we have a UAB Uber system. So if you ever are at one hospital and you need to go to another hospital, you can just use the UAB Uber and it's free. So that's awesome. I'll do that sometimes when I'm at main hospital and I need to go over to for our conference on Thursdays. So I'll Uber over there and then just Uber back, except having to get in my car and worry about parking. All right, so we're here at the VA. So I made it to VA Clinic. So we have one attending that is at the VA full-time. That's his only job. Versus we have some of our attendings from UAB come over. So Dr. Weaver is our full-time general orthopedist over here at the VA. He's great. He just lays knowledge on you about everything. But then some of our UAB attendings come over and help with stuff. So Dr. Johnson comes over and helps with foot and ankle stuff, takes calls. So you'll do some general call cases with him. Dr. Shaw also foot and ankle. Dr. Naranje for joints. Dr. Weaver also does joints, but like Dr. Naranje is there for joints and also your more complicated joints, revisions and stuff like that. Dr. Brabson and Dr. Ponce, two are UAB sports physicians, come over and help with knees and shoulder scopes and total shoulders and stuff like that. So here in a minute, I'll introduce you to a few of our clinic staff. Okay, here is the UAB Clinic. We're gonna go in here with our fearless PGY5 chief, Dr. Chris Beaumont. And here's Dr. Weaver. He got Teacher of the Year for us last year. So Dr. Weaver, what is the best part about working at the VA?
Working with you guys. It's fun. I actually had a message today from a prior graduate thanking me for the tricks that he still uses. He's in practice a couple of years here.
We would probably say the same thing. Working with Dr. Weaver and taking care of our vets is probably the best part of working at the VA. Do you agree?
Absolutely, and I agree. It's a great rotation as a chief, but it's a great time for the PGY3 to really run a service by themselves, and the chief and the attending are here for backup. It's a phenomenal privilege to get to work with all of the staff here as well as all of the veterans.
Next, we'll say hey to Cindy. She's our PA here that helps us with all of our surgical scheduling and how to survive, mainly how to survive here at the VA and do all of our computer stuff and all that. Make sure we don't get lost over here.
Hey, how are you?
Thanks. All right, we're gonna go see Dr. Johnson. He's here with us in clinic today for all of our foot and ankle needs. Say hey, Dr. Johnson.
Hey, what's going on?
What is your most favorite thing about working at the VA?
Well, the VA has a really special patient population with all the veterans that get to come in here. So not only do we get to take care of them from an orthopedic perspective, but we really get to learn their stories about kind of how they got here and the service that they gave our country. And it's really really cool to make those relationships with our vets and really help them with these orthopedic conditions to get them back to the things that they love and enjoy.
Yep, I would agree. Cool. All right, it's OR day at the VA. We got a big one today. We're doing a knee scope, and we had 2 fractures come in overnight. So we have an intertroch, so we're gonna do a nail, and then we have a femoral neck, so we're gonna be doing a hemiarthroplasty. So big day today. So we're in our surgical workroom. We got Andrew with us. He's one of our 2nd-year residents. He's working with Dr. Brabson, so he comes over because Dr. Brabson's operating. And then, of course, again, our fearless leader, Dr. Chris Beaumont, is going to guide us through some of the surgeries today. So excited for a big OR day today. All right, so that's it. We're done with clinic at the VA. Oh, let's get a cameo with our trauma surgeons, Dr. Quaden's filler. So we're done with clinic at the VA for the day. I'm going to head to the gym before our weekly Thursday resident conference. That's at 3. So I'll show you all a little bit of that later on. Gym time. After the gym, I came home to get ready for conference. Our conferences are every Thursday from 3 to 5. They are mandatory. Everyone is excused from their clinical duties, and this is our educational conference where faculty come and give us lectures every week. It is over Zoom right now, so I'll show you all that. Usually we have it in person in this conference room in the OS building, which is the Orthopaedic Specialty Building, but right now Dr. Conklin is giving us our lecture over pediatric topics like cerebral palsies and dysplasias, and so he has a few residents there in person, still following social distancing, and hopefully we'll go back to this once COVID is over, but yeah. So I'm going to join conference now. Oh yeah, one more thing I forgot to mention about conference. When it's in person, we have food, and it's usually catered, and it's usually really good food. So the last thing I get to share with y'all is Friday Night Lights. So we get the opportunity to help out with local high schools and their football teams with their Friday night football games, and it's a great opportunity to be on the sidelines, get some experience there, see some acute sports injuries, and help the athletic trainers with those and other things that kind of come up during the game. And it's an extra cool opportunity to get that experience, especially for those that are interested in sports like me. Okay, we made it. We're here at Friday Night Lights. I have Allie with me.
Hi everyone.
She's a UAB medical student. We also offer them the opportunity to come out and get some sideline experience as well. I think it's usually for students that are also interested in like sports medicine and orthopedics as well.
It is, yeah.
Cool.
Ortho's the best.
See?